welcome to this special edition of Greatest Somerville. I'm Joe Lynch. 2014 is a statewide election year in the Commonwealth of Massachusetts. All constitutional offices, governor, lieutenant governor, attorney general, state treasurer, auditor, and secretary of the Commonwealth will no doubt have lively races for those offices. Governor Deval Patrick's decision to not run again this year has provided the opportunity for multiple candidates to run for governor. It is my pleasure to welcome one of the announced 2014 Democrat candidates for governor of Massachusetts, Dr. Donald Berwick. He announced his candidacy in 2013. He is a physician, a teacher, and a CEO and founder of a 20-year-old healthcare nonprofit institute. Most recently, he was tapped by President Obama to head up the Medicare and Medicaid programs in Washington, D.C. Returning to Massachusetts, he is now campaigning to secure the necessary delegate votes at the Massachusetts Democratic Convention in June of this year. It is my pleasure to welcome to Greater Somerville, candidate for governor of Massachusetts, Don Berwick. Welcome back to Somerville. I had the chance to meet you for the first time a couple of weeks ago.
Yep, I've been here often.
Caucuses?
Caucuses are great.
Is that a word you've been saying in your dreams these days? Caucuses?
It's a busy time, the month of February and early March. You know, every city and town's having caucuses, but it's a great way to get out, meet people, and it's actually been a lot of fun.
From the Berkshires to Boston,
The whole
as they say.
North, south, east, west, the whole place.
Yeah, so it's a busy time.
Yep.
June will also be a very busy time for you. The convention itself for the Democratic nominations will be held in Worcester.
Yes.
This year, June
14th,
mid-June. So there is yourself and other competitors going into the race for this. So best wishes from SCATV,
Thanks
Joe
a lot,
Lynch, and Greater Somerville. Let's go into your background a little bit. You know, some of the other contenders in this race have name recognition. You have built yours up since announcing for 2013, but some of the folks may want to know a little bit more about your background.
Thanks. Well, I'm a father of four, married 38 years to my wife, Ann, who's a public servant. She runs the Department of Public Utilities here in Massachusetts. And I have four wonderful kids. My eldest works in the federal government as a lawyer in the Justice Department. He actually defends Medicare and Medicaid. My second child works in solar energy. My third is a doctor who married a fellow from Zimbabwe in Africa, and she's living in Harare and doing a public service there, and he's a human rights lawyer. And then my youngest is a teacher. She is a middle school teacher, actually in the town she grew up in Newton. We raised all four kids in Newton and been there almost 4 decades. And I'm a pediatrician by background. I practiced for about 20 years at the old Harvard Community Health Plan, the HMO that used to be in town. I also was an executive there. I was vice president in charge of quality of care and got more and more interested in how complex things get better, how organizations and communities get better. I started a nonprofit organization called the Institute for Healthcare Improvement, IHI, 25 years ago actually, and was the founding CEO. We grew it from a little tiny acorn into a big tree. It's a $40 million organization today, works in several dozen countries around the world and every state in America, and works on making healthcare and communities better. And then I got the call from Washington, complete surprise from the new president. Would I come to Washington to run Medicare and Medicaid? That's the largest agency in federal government by budget. It's $800 billion and 5,500 employees, and it's the lead agency for healthcare reform. So I went to Washington. The Republicans had other ideas. They tried to block me. They did block my confirmation, but the president put me in as a recess appointee, which meant that I had full powers, but it was time limited. I had 17 months, amazing months there. Was able to use my skills of 3 decades of executive leadership.
Don, some would say 17 months in Washington is too long.
It was absolutely marvelous experience. I mean, it's a majestic time in this country trying to make healthcare a human right. I got to lead that effort at the first phases of the Affordable Care Act, and to experience what's really possible when progressive government leadership tries to make things better for people.
Let's go into the healthcare thing because it has been the topic both locally here and nationally. Let's talk a little bit, if you don't mind. You know, that is something that many candidates focus on these days, is the whole healthcare system, President Obama's initiative. Massachusetts, actually, though, very few people across the country know that Massachusetts was one of the first states to have that type of health care instituted. And it was under the Romney administration
Right,
that it came
right,
in.
right.
Can you talk a little bit about the difference between Massachusetts healthcare system and the new implemented national system?
Well, the biggest difference is we're pioneers. We're ahead of the game. We passed universal health care coverage. Everybody able to get insurance in 2006, 8 years ahead of the rest of the country. The way I think about it is we made healthcare a human right in 2006, which has got to be the national agenda. Healthcare is not a human right in this country. We're the only Western democracy which doesn't regard it as a right. Massachusetts does. So we can stand to be very proud about that. We also are ahead of the game now because making healthcare a right is just the first step. We also have to make healthcare better because at the way it's organized in the country and in the state, we really can't afford it. It's taking opportunities from other things that the public and private sector both have to invest in. Healthcare costs in the state government here have gone up 60% in a decade. Everything else is down. We're down 25% for parks and recreation, 30% or so for higher education. We're down for local aid. So healthcare is kind of taking resources that other sectors need. And what I know from 30 years of work on healthcare reform is that you can have it all. You can have better care and lower cost if you reorganize healthcare to do what it should do, which is focus on people.
And the thrust, excuse me, Don, the thrust that I heard you speak about at the caucus here in Somerville was about a single payer system.
That's part of it. Part of it is changing care, so it's better. So the system remembers you, it focuses on your needs, because when it forgets you, complications happen, you end up back in the hospital, we don't do prevention. So that's health care delivery reform. But then there's payment reform, and our payment system is just hopelessly complex, extremely expensive. Literally billions of dollars going into pushing paper and conflicting instructions from different insurers. So I'm for a single payer system. If we move healthcare in Massachusetts under one umbrella for payment, Medicare for all, we would have simplification. It'd be easier for doctors and nurses, easier for patients and families, and lower cost. So I think it's a direction we should go in.
I think many people who have private insurance don't understand that complexity. But when you start delving into healthcare, like you have for many, many years, when legislature starts looking at the complexities of healthcare, it's an enormous waste of resource when you're paying administrative costs versus health costs.
Yeah, I'm a doctor, but also mainly I'm an executive. I've run a large organization, grew it to international size. I've run the largest agency in the federal government. And I know the one thing you can't afford is waste that doesn't add value to customers. You have to organize around the need, and pushing papers and filling out forms and dealing with hassles like that's waste. We can stop it. And we have authority to do it under the Affordable Care Act. The state can go to a simpler payment system as long as the quality goes up and not down, and as long as the costs go down, we can do it. So we have the running room. We've been pioneers before. I say let's be pioneers again. Let's show what that's like.
So you're basically, your CEO executive experience is going to be one of the things that you're telling the voters in Massachusetts, which makes you qualified for governor.
Yeah, I'm proud to be a doctor. I loved it. I want to take care of patients. But no, my main role in the past 3 decades, really, in terms of my professional work, has been as an executive, leading and managing an organization. And I happen to have the theory that government should be managed like a great company, a great business is. You know when you're dealing with a business that has you in mind, that you come first, and they honor your own needs, and they don't waste your time and your money. Government has to do the same. And I'm looking forward to bringing that skill to the corner office.
And I think there are many voters who probably want to see that as well.
I think so.
Yeah. It's our money that you're spending. Spend it wisely. Let's move into that a little bit, if you don't mind. The Commonwealth of Massachusetts during the Great Recession that started in 2008, 2009, was not hit as hard as other parts of the country. Yet we saw the result of that. The slowdown in jobs, the jobs growth, the economic vitality of the Commonwealth. Let's talk a little bit about what you can provide to the voters out there. How do you see us moving forward? We're coming out of that recession, but we're still in a competitive mode with other New England states, with other states across the country.
Well, first, we were hit pretty hard. I mean, as you go around the state, and I've been in so many cities and towns, there's pain. There's pain. People are suffering from lack of security in their own futures, lack of jobs, lack of a sense that they're being treated fairly. We're we're part of a country which is drifting apart in income disparities and income inequalities, and it's not good. We need to be united, and that will happen when equality becomes center stage again in terms of our view of how we want to manage ourselves and our communities. Social justice matters. That does have to do with jobs. People need access to employment. A person that goes to work 40 or 50 or 60 hours a week, he or she ought to be able to support their family on that, and many, many cannot right now. So I want to engage in policies which begin to close that disparities gap, and especially offer people at the bottom of the income ladder a chance to participate in a robust and growing economy and society. We've got to commit to that, and if we don't, the social costs and the human suffering is just too great.
So you think we're in an era of the rich are getting richer, the poor are getting poorer. Let me ask you one question. We did, correct me here, we did vote to increase the minimum wage here in Massachusetts.
We're getting there.
We're
yes.
getting there.
Yeah.
What are your feelings on up to, what is it, 10 an hour?
10.50,
10.50
11,
an hour.
it depends on which proposal, but yeah, no, we have to get there. I mean, a minimum wage of $11 an hour for a working person at 40 hours a week means they're $3,000 above the poverty line in America for a family of three, 19,500 or so. That's not good enough. It's a living wage that matters, plus security. Security that if you lose your job, you can have unemployment benefits for a while to get you back on track. Security that if you get sick, you get paid. I think help for people with daycare so that they can go to work and know their kids are well cared for. No, this is serious investment. It means making it possible for you to raise a family successfully, and that your work is paid for at a level that's valuable. This helps, of course, the worker, which is key, but it also helps the economy, because once people have money in their pockets, because we have a just and fair system of payment for employees, then that money circulates. They go down the street and they go to a restaurant, they go to a movie. That money starts to circulate. So the worst investment in our economic health is to allow poverty and unfairness to dominate the economic scene. It's not right. I don't begrudge the wealthy what they have if they've got it fairly, but they have some responsibilities now, which is to help us elevate all boats.
Let's go a little bit into staying on the vein of being the Chief Executive Officer of the Commonwealth. How do you plan to handle that unruly bunch up on Beacon Hill? You would have an advantage, though. Let's just be very blunt with it. You know, Massachusetts is a blue state. It has preponderance of Democrats up on Beacon Hill. However, the current governor has had some issues with them, and they fought back, and the governor has fought with them. How would you handle that crew?
Well, I can't second guess the current governor. He's done a great job, but I know how I lead as an executive and manager, and my style is inclusion, open door. I've met with many legislators now, senators and representatives, as many as I can, and they're normal people who have things they care about. They're supposed to represent their communities, but they share some important elements of a value system in common with me. Many of them believe, as I do, that social justice matters. We need to fight poverty hard in this state. We need to, I mean, I come from the era when we had a war on poverty. Let's get it back. Let's end this disparity. I care deeply about children. I don't want 4-year-olds not to be ready for school at age 5. That's wrong. I care about mobility and people being able to get to their jobs and back. We need to invest in a transportation system just so we have vibrant communities and an economy that works. We have a correction system that it's really bad. I mean, despite the efforts of sheriffs and others, they're trying hard, but it's underfunded, and we've criminalized things which are really mental health problems. We don't have the supports for people to get out of our prisons. Therefore, our prisons bulge, and we have expenditures.
And the
answer
answer so far, excuse me, John, the answer so far is to build more prisons.
Yeah, it's not the right answer. The right answer is first not to send so many people to prison. Give people let judges have the opportunity to say, you know what, really you need is help to get back in the mainstream, and instead of sending you to prison where you learn to be a better criminal, and then in the prisons have rehabilitation. But all of this takes investment and commitment. So my view of the legislature is, let's go to the social compact. What community would you like to have? What's the Commonwealth you envision? Let's build from that platform. I think there are enough people in our legislature that share that vision in common that I look forward to working with them. And those that don't, those that think that if you're poor, it's your problem, not mine, dig yourself out, or that it's okay for a kid to be hungry, or we should back away from universality in healthcare or not promise education to kids, I will fight them. I'm not as nice as I look.
I admire your optimism when it comes to working with the legislature.
Look,
But if you're successful, I want to have you back here next year, and I want you to say the same words to me about the legislature.
I will. I promise you. Any executive knows that you're never really the boss. You win over people's energies through common values. And I'm not naive. That doesn't end the story, but it sure does start it. And that's how I would approach this legislature.
Talk a little bit about the difference between what you've seen in terms of the issues that are for the eastern part of Massachusetts, say within 495, and then you may have a different set of issues in the Worcester mid-state, and then a different set of issues out in the Berkshires. Very quickly, can you kind of go statewide and tell us what those are?
Yeah, regional equity is key. We can't, no governor, none of us should forget the others. You know, we're one state, we should act that way. The names of the issues sound the same: education, transportation, healthcare, but the texture varies from community to community. And so for the western part of the state, a lot of it is rural healthcare. How do you have small hospitals or rural clinics really thrive? In the east, it's how are we going to support our magnificent medical centers and still afford healthcare? For education, it has to do with equality of education, equality of access, and make sure that people have access to really sound higher education. So it's the same theme, but different riffs on it. And then there are region-specific issues. You know, if you go to the west, broadband access and making sure you have access to modern internet services. Our north and south coasts are very regarded the fishing industry as crucial, central to their needs. Transport sounds different. Inside 128, and how's the MBTA functioning, and how can we get it back up to proper maintenance? But if you're out in Greenfield or Pittsfield, you're going to be talking about regional transit authorities and buses and bus routes and bus adequacy. I find it challenging and really interesting to think as a governor about equity, about, you know, everybody gets a fair shake at a piece of a growing economic pie. That's really crucial.
And it's right across the state. I mean, Boston, the capital city and the metro region can't carry the rest of the state with the job growth. No. It has to be statewide.
Yeah, the Boston metropolitan area is a driver. It's an asset. We all benefit from it in the state if it's doing well. But no, we have to find, in each community has strengths. You know, the arts communities out in the west, the beauty and tourism opportunities in the Cape, and the port in New Bedford. Wherever I go, I carry, maybe it's because I'm a pediatrician, I carry in the question, what are the strengths? What is there to build on here? And there's no place in the Commonwealth that we don't have some really strong structures to build on, but then we have to build on them and make it true.
So building on it, working with, well, let's leave the folks on Beacon Hill alone and talk about the congressional delegation. Any governor has to work with the folks who are in Washington representing our interests. You've had your taste of Washington. I know that we all say a little prayer for our congressional delegation. Those folks are going to be fighting for local things here in Massachusetts. One of the things, let's bring it a little bit closer to Somerville, in that one of the things that we're waiting for is the complete funding of the Green Line. Many of us who fought in the trenches about getting this transportation initiative in here. We've been waiting for 35, 40 years for it. It's about ready to happen in the eastern part of the city. We need the congressional delegation, with the advocacy of the next governor, to get that funding in place for the rest of the city and for Medford.
Well, first I'll comment on the delegation. We are really fortunate to have this delegation. When I was in D.C., the contact, the intelligence, the real commitment that these people had when Senator Markey was Representative Markey, we talked often, and I really was so excited by the sense of these people's commitment to our nation as a whole and to this Commonwealth. We're very, very fortunate with this delegation. It is a time in Washington when we're backing away as a nation from the progressive agenda, the commitments to justice and equity that I've been talking about, not these people. They're fighting for it. Watch what Elizabeth is doing, amazing. I mean, she's becoming a leader of the new populism in our nation. So I'm very excited about it. I look forward to working with them. We need to make sure that resources come into this state that can help us dig out of some of the holes we're in our backlog of transportation needs, getting stronger education. My own view, by the way, though, is if we are in a nation which is backing down from some of these commitments, we've got to step up as a state and say, we're not going to let that happen. They want to take food stamps away from kids and make them hungry. We've got to feed them. If we want people, if they want to take away security around, people to get back into the job market, we've got to help those people. We can't pass the buck on this one.
That puts more and more pressure on the state level.
It gives us a chance to lead, is the way I'd say it, to show the rest of the country what a progressive agenda looks like.
The current governor has tried, on many, many occasions to try to get that delegation moving forward in terms of bringing money back to the Commonwealth. One of the things, though, when you get into that CEO seat are decisions that you'll have to make it solely on your own.
Yes.
One of those decisions that has been made is about casinos. Can you talk a little bit, very briefly, about your position on casinos?
Yeah, I've studied this. I am against casinos. I'm for the repeal. I think I'm the only candidate that has that position in the Democratic ticket, contest. I think it's a bad bargain for the state. I think the costs way outweigh the benefits. Casinos hurt small businesses in their local areas. They cause an increase in DUIs and petty crimes. We know this from other states. They don't bring in as much revenue as it looks because they cannibalize the lottery revenue that we're quite dependent on. And they add a mental health burden. Here we are in a state that's reeling from our healthcare costs. We already have a weakened mental health system that we have to shore up. These would add a significant burden of gambling addiction, which hurts the gambler, it hurts the family, it hurts the community. I wouldn't go there.
Have you had a discussion with Treasurer Grossman about getting rid of the lottery too?
We talk.
You talk. I know. That was kind of an aside there, but let me ask you another question. A tough decision that the current governor may have to make. Department of Children and Families. Some disastrous news coming out of there.
Yeah.
You think it's fair what they're doing to Commissioner Olga Roach, or what's your sense on that?
I can't have access to the details of the commissioner's activities. I'll tell you this, what we need is reform and a commitment to kids, and we have to resource that. I've talked with many of the social workers and others who work in that facility, in that agency. They're under tremendous stress, higher caseloads than they should be bearing, insufficient supports, and we're all in this together. We need to build a safety net around our vulnerable children, and we do that together. And I'll tell you, I don't think a head on a platter is reform. Reform means we get together and we build a strong support system for kids who are really in need. These were my patients. These were kids I took care of, and I know what it's like to fight really hard for their interests. As governor, I'd have their back.
You're going to have a big checkbook, but you're going to be constantly looking for more money, improving the infrastructure that's here in the state. It's not all going to come from the federal government. You're going to have to think about maintenance of roads, maintenance of bridges, new initiatives. How do we do that while keeping the tax burden off of the average Joe?
3 ways at least. We do need to invest. There's no question in my mind. We're $15 or so billion behind in supporting our transportation structure. Our education system should be world-class across the board, leaving nobody out. That's going to take investment. Our community colleges, I could make a list of things that reflect a progressive agenda in the building the Commonwealth we want. 3 sources of money. One is healthcare. As I told you before, it's gone up 60%, 70% in the past decade or so, taking money from other areas. A governor who understands what better health care looks like at lower cost. Also, I think a single-payer system that will give us back potentially billions in the state budget alone. It's 42% of our state budget we're talking about here, $14 billion. And by the way, it helps the private sector too, because if you talk to a business and say, what would keep you in Massachusetts, they say, well, lower your health care costs. Right. The second is tax reform. Tax loopholes and exemptions need to be looked at. We really need to look at the exemptions we've written into law over time and decades now. I would reset to 0 and then add back or keep ones that improve the safety net or that add jobs. And the last is fair taxation. I will fight for a tax system in this Commonwealth that allow people at the lower end of income spectrum to be paying lower tax rates, and people at the wealthier end of the income spectrum to be paying higher rates. It's just fairness to me, and we need to go there.
Spurring economic growth oftentimes means that the Commonwealth has to step forward for new industry that's coming in. Current governor took a hit when one of the companies came in, took a big chunk handed some money, and then fled. What would you do if that same initiative was put forward in front of you? Would you demand repayment?
Yeah, we'd be looking at comprehensive reform, including clawback there's a deal, you honor your deal. And so that's what I say. If a tax break helps create jobs for real, it's worth it. But no, you can't take the money and run, not on my administration.
Who knew that 28 minutes was going to fly when you have like minds sitting here at the table? I'm going to give you a few minutes, a couple of minutes to wrap up.
Well,
yours, John.
My feeling, and the reason that's really driving me to do this, has to do not just with the risks to the Commonwealth if we don't recommit to the progressive agenda, the agenda that says that government is a necessary tool for us to create the communities that we want, but the nation is at risk. I've seen it now. There are people out there who really do believe you don't help. I grew up in a small town. In that town, if you were driving along a road and there was a car broken down, you stopped your car. You would stop your car and say, "Can I help you?" That, to me, is core to the kind of community I want to live in, the Commonwealth I want to have, and that is at risk today. There are people who think that's naive or unaffordable. I don't.
Old-fashioned. Yeah.
Well, it's needed. I think that in this Commonwealth there is an undercurrent that will surface this decade of the new progressivism, the new populism, where people are finally going to say, no, 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 we can't let the power just follow the money. We can't let the connected control. We are communities. We are together, and we have to create together the Commonwealth we want. That's the progressive agenda for me, and we use government to do that, and we invest in government to get that job done, and that's the kind of leader I'd like to be.
Big times coming up. Caucuses from now until forever.
Yeah.
Big time coming up in June. From SCATV, Greater Somerville, all the best in June.
Thank you so much.
I might see you out there in Worcester. Who knows?
I'll count on it. Thank you very much.
Thank you very much.
Appreciate it.
Thank you for joining us here on this special political edition of Greater Somerville. My guest has been Dr. Don Berwick, candidate for governor of Massachusetts. As always, stay safe, stay informed. See you next time.